So my name's Cheyenne Whitetree, and my internship was wildlife treatment crew. It was at the College of Veterinary Medicine. So we were in the big brand new hospital on College Station Road. They treat around 25,000 patients per year. They have over 25 specialty services, which includes things like radiology, aquatherapy, small and large animal medicine, and surgery. So my job was a wildlife treatment crew summer intern. We are housed in the exotics ward, which also does zoo med. So in the exotics ward, they had zoological medicine and then wildlife, which is a small part there. They get several $1,000s from the vet school a year, but the majority of their funding comes from the Kate Grant Wildlife Fund. And for the internship, we were required to get a rabies vaccine. And that's about it. So our main goals were to care for orphan and injured wildlife. This included doing physical exams, completing the medical records for each patient. We learned proper husbandry and nutrition for the animals. We got to administer fluids and their medicinal drugs, so things like meloxicam or anti-inflammatories. And then we were responsible for discharging the animal from the hospital, which included finding a rehabber and transporting them there. Not working. This is an example of the patient chart that we would keep. So it shows like the patient in the top corner, and then the treatment plan is all written right here. So you have like their diet, their weight, and then you just note any changes on the back and you sign off on their treatments. So our daily tasks were every morning we had treatments at 7 a.m. and then the treatments continued on throughout the day or night. So if you had like a baby bird that needed to be fed every 2 to 3 hours, you were there every 2 to 3 hours. The students did rounds at 8:30 a.m. and around 4:30 p.m. So ideally your treatments would be done before those, so you could update your student on your patient. We would get new patients in daily, and we had a treatment or a call list. So we would be partnered up with another intern, and they would call us as new patients came in. And so whenever a new patient came in, you'd help with a triage and then develop a treatment plan. That could just be like feeding every 2 to 3 hours or changing bandages or anything like that. And then you were responsible for discharging your patients. So that was an example of the paperwork. You would basically write all that up into like a summary form, and then you would discharge them from the hospital and transport them to a rehab center or wherever they were going. Some of them went to like zoos, some of them were just released. So our work environment was basically we had instructors, our wildlife treatment crew supervisors, and then hospital staff. So we had our faculty, Dr. May and Dr. Divers, and then we had our interns and residents. That was Dr. Izzy and Dr. Dupre. And then you had your students that were on the rounds. So all the vet students do different like length of time in different services. So we had a few fourth-year vet students that were there to help us out. Those were the ones that got assigned to the case, and then we would just develop or we would help them carry out the treatment plan. Since we are in the exotics ward, they had actual client-owned cases, and then their zoo cases, and then wildlife was just kind of on the side. And then we had our hospital staff to help us out. Like the hospital orderlies would make sure that we had everything that we needed. So that's Chip in the corner. That's one of my partners. He was dressed up for one of our patients. We had a baby vulture that we didn't want to imprint on, so we disguised ourselves every time we fed them. But as an intern, we got to act as the vet students, because usually during the year, the first, second, and third years would be able to sign on to wildlife treatment crew to get credit for a class in vet school. But since they're gone during the summer, they open it up to undergrads. So for relation to our now classes, wildlife diseases helped a lot, just being able to look for different signs and symptoms, although I didn't see any diseased animals. Physiology and nutrition helped a lot with just knowing a lot about like different needs for nutrition for different animals, and then VERT because of all the natural history stuff. So here's some of my cases. This is our very first case. It was 4 teeny tiny baby mockingbirds. They needed to be fed every 2 to 3 hours. They were basically naked and blind, and it was awful. They all died. This was our barn owl. His name is Furby. He had gotten hit by a car, and he was presented by a Good Samaritan who was concerned about him because he just was found on the side of the road in the morning looking all dazed and confused. So we brought him in, we gave him some anti-inflammatories for his eyes, and just tried to keep his weight up and feed him. He ended up being released to a rehabber. This was our Canada goose who was hit by a truck. He had to have a blood feather in his wing surgically removed. He was a goose, so he was basically mad at the world the entire time. He would hiss at us as we tried to feed him, but he really, really loved frozen vegetables, so he would just kind of like slide a bowl of frozen vegetables into him. But he ended up being released to a rehabber. Yeah. This was Albert, or Count Olaf. He was a baby mockingbird. They said that they had fallen out of his nest, but really he was fine. So we just kind of fed him for a few days, made sure he was keeping weight, and then released him. This was a yellow-bellied slider that had gotten hit by a car. We see a lot of animals that get hit by cars. And the people who brought him in had actually been keeping her for a few days. And so whenever she came in, she presented with maggots in all of her wounds. And she had a giant cut underneath her chin, and she actually had 4 eggs. So they did x-rays the next morning after they like cleaned all the wounds, and found that she had a fracture in her leg, and it was so bad and she lost so much blood that she wouldn't be able to make it through surgery. So they euthanized her, but they did take her eggs and incubated them. So that was pretty cool. They haven't hatched yet. So still waiting. This was by far my favorite case. It was a fawn that was just taken from its mother. So it's kind of sad, but it was really fun to feed her for the day that we had her. And then we released her to a rehabber. And I've seen pictures of her on Facebook, so she's doing good. Her name was Buttercup. And then this was another really cool case. Our baby vulture, his name was Steve Riker, and he was really fun because he was only a few days old. He still had an egg tooth whenever he came in, and we didn't want him to imprint on humans, so we would like dress up in that crazy costume and like play little vulture noises for him, and he got really used to them. And so whenever we'd start playing the vulture noises, he would like start like flapping his little wings, and he was really excited. We started feeding him dead mice, so we would thaw them out and then like cut them up, and we'd have to like pull the skin off of them and like pull out the entrails and then feed it to him. So we would spend like a good like hour every morning just like pulling apart mice. All right, so that's it. Any questions?